My statement today is to provide an update on the COVID-19 situation and to announce the proposed measures that will come into effect after the current set of measures under the Disaster Risk Management Act, which will expire on February. I did that one deliberately. Which will expire on Friday, September 17, 2021. Based on the last report from this morning, Jamaica recorded 510 new cases of COVID-19 yesterday. Our cumulative cases of COVID-19 are now 77,497, and sadly, 1,757 persons have died. My condolences to the families and friends of those who have passed. And this morning I saw the news where 2 more healthcare workers succumbed to the disease. Madam Speaker, we express particular condolences and sympathies to the families of those who have passed, and I do so on behalf of the entire Parliament of Jamaica. Madam Speaker, the graph that is now being displayed shows that the number of COVID-related hospitalizations, which is the white line, continues to significantly exceed our COVID bed capacity, which is the black line. While you can see that the curve has started to bend, we're not yet seeing a sustained decline. So it appears, Madam Speaker, that we may be moving sideways in the numbers for a little while before we see a sustained dip. But thankfully the curve is bending. The second graph, now being displayed, shows the test positivity rate by week. You can see from the white line that while the positivity rate has started to trend downwards, we are seeing an uptick again. So the curve is again probably moving sideways than having a sustained decline. You can see from the color coding that we're still in the very high transmission bright red zone. The third graph, which is now on the screen, shows our reproductive rate, the R0. The average rate of additional, that is the average rate of addition, the average number of additional persons that are infected by a single infected person. The R0 is showing a decrease and has fallen from 1.4 to 1. Madam Speaker, you will recall that in order for our cases to decrease, we need to maintain an R0 below 1. So the R0, Madam Speaker, just for public understanding, would be the additional number of persons that are infected by one infected person. So obviously, if your R0 is 1, then your rate of infection would be continuing at the same level. If your R0 is above 1, your rate of infection will be increasing. More than one person will be infected by each person that is infected. And if your R0 is below 1, then it says less persons are being infected by the infected population, and therefore your infection rate will start to decline. And where we want to be is to be below 1. So you can see that the R0 is almost consistent with the other figures that are moving sideways in the graph. So what we are hoping, well, not hoping, what we have put in place and the measures that we have established would have resulted in citizens changing their behavior such that you are seeing the result being that your rate of infection is starting to decline, but not declining enough to take us out of the danger zone. So with an R0 of 1, we are still in the danger zone. We will probably remain at this level of infection until we see that R0 trending below 1, then we can definitely say that the infection rate is going down. Madam Speaker, while the measures implemented over the last 4 weeks have seen a bending of the curve, our numbers remain unacceptably and dangerously high. We are by no means out of the woods. The measures, especially the no movement days, have, however, had a massive negative impact on productivity, on the economy, and on the livelihoods of thousands of Jamaicans. But that is the price that we have had to pay to arrest the spike. Madam Speaker, this is not a price that we can continue to pay much longer. So, Madam Speaker, the government has always been clear that tighter restrictions on movement through lockdowns come, as I've said, at a very heavy economic cost and are not sustainable for long periods. The only sustainable way out of this pandemic is the exercise of consistent personal responsibility on the part of each citizen. Madam Speaker, I was touring with the member for East Kingston and Port Royal today, where we visited his vaccination blitz site. Unfortunately, I didn't get to do the extensive touring, which I was hoping to have done, but other matters would have intervened on my time. But it was still a very beneficial visit to the vaccination blitz site, which was held at a very successful primary school, Windward Road Primary, which has done well over the years. But, Madam Speaker, what was memorable for me was that on exiting the site, I heard a chant coming from a group of young people, and they were saying, "No more lockdowns, no more lockdowns." And I was wondering if that was orchestrated or planned in any way. But the member assured me that it was all spontaneous. And it was all in good spirit, Madam Speaker. He was the member for the constituency, the member of Parliament, was very courteous, and the persons there were very respectful and embracing. And I went over to them and I said to them, "Wear your mask, social distance, take the vaccines, and no more lockdowns." And they all laughed, and it was quite a friendly exchange. But obviously the point got across. Personal responsibility. And we can avoid paying this heavy cost of lockdown. But I want to just put it squarely on the table. Lockdowns are restrictions of last resort. They are measures of last resort. We don't want to do them. We don't like to do them. But they are the measures that work when we are in the grips of a spike in the pandemic, where, as we have shown earlier, the number of persons seeking hospital treatment far exceeds the number of beds that we have. Madam Speaker, if every Jamaican were to take personal responsibility in their conduct, we would not need lockdowns. If every Jamaican were to wear the mask faithfully and consistently and appropriately, if every Jamaican were to recognize the importance of maintaining some physical distance, were to recognize the importance of sanitization, were to recognize the importance that if you are ill, with any respiratory-like symptoms, you're not sure, stay away from the rest of the population, get tested before you go out and start to mix about. If every Jamaican were to do this, the R naught, the reproductive rate of the virus, would go down. And then you would see the general infection rate go down, your hospitalization rate go down. But there's one more thing that can be done that strengthens the entire population and locks out the virus, and that is to get vaccinated. So these are the ingredients of personal responsibility. If we do that, then there would be no need for lockdowns. Madam Speaker, successfully navigating this pandemic requires not just an all-of-government approach, it requires an all-of-society approach. Without a disciplined all-of-society approach, we end up in this seemingly never-ending cycle of locking down and opening up. Madam Speaker, this is not sustainable. Before I announce the new measures, I want to give an update on the national vaccination program. As of yesterday, we had administered 686,829 doses of vaccines. 686,829 doses of vaccines. I am certain that we have crossed the 700,000 mark today. 478,660 were first doses. 191,009 were second doses, and 17,160 were doses of the Johnson & Johnson single-dose vaccine. So the number of persons fully vaccinated, therefore, would be 208,169, representing approximately 7% of the population. So, Madam Speaker, though we are increasing coverage and moving very rapidly, because as Minister Tufton told me last night, the target that we have set for September, we have already reached it. By today, we would have reached it. So take-up is increasing, but let's not be relaxed about it. We are far from attaining the goal of 65%. And by the way, that goal, I'm certain, will have to be revised. So we still have, Leader of the Opposition, a long way to go. And our voices are important influencers in this. And I am awaiting your response, Mr. Leader of the Opposition, as to how we can collaborate even further in getting that message across. And I want the entire country to know that, yes, the Leader of the Opposition and myself, we had a meeting and we discussed the vaccination program, amongst other things. As announced yesterday, the Ministry of Health and Wellness explained that the administration of the Pfizer vaccine would have to be suspended pending receipt of further supplies from the United States, which we expect within a few weeks. This means that approximately 82,545 persons, based upon yesterday's count, who are due their second doses will have to wait until the shipment arrives. Madam Speaker, the WHO recommendations are that the second dose of the Pfizer vaccine may be administered within 3 to 6 weeks of the first dose. However, we have seen in other jurisdictions where they have extended as far as 12 weeks. It is not our proposal to go that far, and we are working, and I can tell you now, I haven't said it to the Minister of Health as yet, but maybe you would have got the call, that the Minister of Foreign Affairs is working the phones assiduously, and she has gotten what I consider to be a favorable response from a sister country within CARICOM who has stocks. And I won't say until the plane lands, because the logistics involved in getting stocks here, particularly where cold chains are required to be maintained, those logistics can easily change. So there is some hope, and I would ask persons who are awaiting their second dose not to panic. Government is working overtime to ensure that we get supplies in, and we're not putting your health at risk. We're working very hard to bring in the additional supplies. So I'm expecting that we should be able to restart in short order. But let me just say something on that. When we got the first shipment of Pfizer, which was not in our original program of purchase, the strategy was that we would reserve Pfizer for children 18 years to 12 years up to 18 years who are within the school system, registered in the school system. And that was a strategic decision, Madam Speaker, to ensure that we could return to face-to-face. There are some persons in the population that special exceptions were made for, but when the new stock comes, the strategic direction will be strictly maintained. This will not be widely available to everyone, because we cannot guarantee that we will have the supplies to everyone, and the strategic intent is to ensure that we can return our children back to school. Worse than that, Madam Speaker, is not the intention of the government to encourage vaccination by brand name. The first vaccine that you get is the best vaccine. Ask the people who are in hospital now who will take any vaccine that you give them. So we have to be very careful that we don't, as a government, feed into certain narratives and expectations that are created by perceptions that are not necessarily driven by facts. So, you know, we have noticed people turning up at the site saying they want this one. All the vaccines have a proven level of safety and efficacy. Right? I have taken a particular vaccine and I think that one is good. I was going to say it another way, but I don't want to. Right? Others have taken it and they are saying, yes, I'm fine, it's good. But anyone that you take will save your life. And at the end of the day, that is what this is about. It will save your life. If you get sick, the probability of hospitalization is far reduced. If you get sick, the probability of a fatal event occurring is far more reduced. So take the first vaccine that is available. That is the best vaccine. Madam Speaker, we have adequate supplies of the AstraZeneca and the Johnson & Johnson vaccines, and I encourage all Jamaicans 18 years and older who have not yet been vaccinated to get one of these vaccines that are available. Now, there are some persons who are saying, why are you not getting the Cuban vaccine or this other vaccine or that other vaccine? I've had discussions with the Minister of Health, and you know the process, and they are going through that process to engage suppliers. Sometimes we believe that these vaccines are available, but remember, these countries sometimes they have to deal with their populations first before they can make them available. So yes, we are looking at some of the other vaccines and you will hear more about them. But do not wait. Because I hear people say, I'm not taking any vaccine, I'm waiting until that one comes. Remember, the first vaccine that is available is the best vaccine. Madam Speaker, just over a week ago I appointed the Vaccine Operationalization Task Force chaired by Professor Gordon Shirley. The purpose of the task force is to liaise with the Ministry of Health and Wellness and the private sector in order to scale up and streamline both the public sector and private sector managed aspects of the national vaccination program and to make it more accessible, efficient and seamless for the Jamaican population. Specifically, the task force will, 1, implement strategies to recruit additional suitably qualified, trained personnel not currently within the public sector health system to facilitate scaling up of the national vaccination program. To engage with various sectoral groups to encourage participation in the national vaccination program and oversee the administration of public-private partnerships, and to examine and optimize the operational and logistical aspects of the vaccination program from end to end. Madam Speaker, let me say here that I watched the TV news reports last night on the overcrowding at some of the stations, and I saw the frustration on the faces of the people who were there, and indeed the frustration of some of the coordinators and organizers. And Minister Tufton and I had a late conference going through some of the issues. So in one sense, we are relieved to see people actually coming out to get the vaccines. And we encourage people to continue to come out. But on the other hand, we are concerned. We don't want to be creating super spreader events at the same time trying to administer vaccines. And we don't want the inconvenience of the attempt to access to become a deterrent. So there are changes that we will have to make to improve the delivery of the vaccines. But I think in the conversation, I need to put in the narrative so that the public understands that it is not ineptitude or lack of care, or as some persons say, slackness, why we see sometimes a slow process and overcrowding. There are some real challenges. The nurses and the doctors that you see at the various blitz sites across the island are the same nurses and doctors that are in the clinics and the hospitals all around the island. So when we pull them, it means that service in some other area will, for that period of time, be not delivered. And, Madam Speaker, we can't keep them there for an extended period, so we can only do it for a day because they have to go back to their substantial role. The requirements that the Ministry of Health has in place to ensure that the vaccines are delivered safely puts in place a procedure that is considered in some instances elaborate, but necessary. Because what we wouldn't want is for someone to come to a vaccination site to be vaccinated and they have an adverse reaction and we are not able to respond to them. So that requires a system to properly account for the vaccines. So from warehouse to site, that's a whole logistical effort to make sure that every single drop of the vaccine is accounted for. We know what the temperature is, we know the batch number, we know who got it, the chain of custody is maintained. That is an entire logistical operation. Then we have to make sure that we properly track and identify the person who got the vaccine. Because if anything were to go wrong, we should be able to say that John Brown, Mary Jane, and Tom Stroke got a vial for which there was a problem. So because we track batch number and the proper name and contact of every person. So you notice there is almost a double registration. You go in and you write it down on a paper, and then they transfer it digitally, and then it gets uploaded in our database. This is all done to protect you, the citizen who is taking the vaccine. We are putting in place all the precautions. Then when you go, you have a public health education officer who goes and explains to you the vaccine, how it works, that, you know, you might have to take some Panadol. I took 2 before, and then I took some the 2 hours after, you know, that you might have a little headache, maybe a little flu feeling, and it will go away. And she goes through, or he goes through, and explains the entire process. And then after counseling, the nurse comes as the fastest part of the process. It was so fast, I didn't even know, leader of the opposition, that I got my vaccine. Of course, you know, that created a stir in and of itself, because that nurse, she has a, you know, she was very quick. I didn't even feel it, because I went in there with great trepidation of the needle, not the vaccine. A lot of you in here also went in with trepidation. So but, Madam Speaker, after that is done, then there is a process where you are observed for 15 to 20 minutes, just to make sure that if there is an immediate adverse reaction, we can respond to you right away. Then we have to track you for your second dose, which is an amazing system, because you'll get a text or a telephone call to tell you, come to X place for your second dose. So, yes, there is incredible frustration, and people have a right as taxpayers to say, we demand better service. And I want to apologize to those persons who have been delayed to the point where they were not able to get their vaccines. I want you to know that we are working very hard behind the scenes to continue to do the vaccinations while at the same time making the changes. So we are driving the car while fine-tuning the engine, because we don't intend to stop the vaccination program, which is what would probably be required if we wanted to just deliver to you right up front an efficient vaccination service. And what would be required to do this? We need to get a set of vaccinators that would be persons who are suitably qualified, as I said before, and approved by the Ministry of Health, who are not in the public health system, meaning that they don't have to leave and go back to their regular jobs. Their job is just to focus on vaccination. So the Operationalization Task Force will very soon be launching a program which will continue the effort of the Ministry of Health in getting, for example, retired nurses, retired doctors, nurses and doctors and other health professionals who are in the private sector to come on board to form this national vaccination corps that will focus wholly and solely on delivering vaccines. This way we can have sites that we stand up 7 days a week, 9 hours a day. So in that way, persons can schedule their attendance at the vaccination sites with greater options and reduce the level of crowding. We are told, Madam Speaker, that when we announce the Blitz, persons are at the sites 3 or 4 hours before. I'm told people are at the site from as early as 4 a.m. So much better use of the current resources would have to be made, Madam Speaker, because, for example, at the site I visited today, by 1 o'clock, the site was empty. But from 7 o'clock before to midday, the site was full. So in the morning, everybody is crowding the sites, but in the afternoon, the stream of persons seeking vaccination slows down. So we may have to split the sites by hours and saying, well, there is a morning session which is from 9 to midday, and then there is an evening session from a certain number of hours. So, Madam Speaker, we are looking at all the ways to improve the vaccination rollout. There are challenges, and we're trying to work our way around them. We have begun the process of broadening the vaccination program to increase the number of access points for vaccinations, including private hospitals, health centers, pharmacies, doctors' offices, faith-based and other institutions. The Ministry of Health and Wellness has issued a request for quotation, RFQ, which sets out the criteria in terms of personnel, infrastructure, and protocols that must be in place. The requirements are scaled for entities of different sizes based on the number of persons to be vaccinated per day, ranging from 50 or less than 2,000 per day. Basically, the RFQ is inviting private sector and other entities to submit proposals setting out how much they would charge the ministry to administer each dose of the vaccines. Madam Speaker, let me be clear that it is the government who will be paying these private sector entities to administer the vaccines. The citizens receiving the vaccines will not be charged. So, Madam Speaker, this is a major development which the Ministry of Health is leading. And what essentially this does is to engage private persons, private entities, to deliver the vaccines. So all the effort that the ministry is making, the private entity will take it on. They will use the standards set by the Ministry of Health in terms of the management of the cold chain, how the vaccines are delivered, the observation, having the emergency response if there is need for such. And we will pay, the government will pay the private entity per person vaccinated. And so it is a competitive process. Persons who are involved in healthcare will be sending in their own quote on what it would cost. And of course, there are different packages, so you could have an entity that could do, 50 to 500. You may have another set, 500 to another threshold. And eventually, when that process is through, we should have right across the island private providers of the service, and that will augment what the government is now doing. But, Madam Speaker, we can't stop vaccination now and wait until that is in place. So we continue, we bear the criticism, bear the complaints, whilst we are building out the system. So hopefully, Madam Speaker, this process will move much more quickly than other procurement processes, and we should be able to have standing private sector entities delivering vaccines and thereby increasing the capacity of the government. Madam Speaker, in addition to broadening the number of access points and entities doing vaccinations, we are also trying to ramp up the number of vaccinators, as I've said before, by recruiting retired medical personnel. And just to repeat, Madam Speaker, we will be launching a national call for vaccinators. And this is not just in Jamaica. We're calling on the huge resource that we have in our diaspora. In fact, Madam Speaker, many of our nurses that have left here, gone to the United States and the United Kingdom to work, now would be an excellent opportunity for them to come back and participate in this national vaccination program. Now would be a good time for them to come back and participate. You remember, you got your education and training and exposure and the name of Jamaica. So it will be good. And the truth is, Madam Speaker, that, it's always inspiring. There are a number of Jamaican doctors and nurses who have been calling to say, how can we help? How can we help? They've been calling our embassies and consulates, and they're quite frustrated because our system is not designed for government to incorporate them in helping. What you find more often than not is that the NGO sector works very well, but government systems aren't so well coordinated because they have regulatory, legal, and other differences. So it's very difficult to bring them in. But with this national program, all of that will be worked out so that they could come and assist seamlessly. So, Madam Speaker, we're also looking at the appointment system to see how it can be improved and simplified to encourage more persons to make appointments for vaccinations either online or via the call center. We have 100 persons that are dedicated to manning the call center phones. So, much of the bundling that we see at the vaccination sites could be reduced if persons were to utilize the pre-registration and the appointment system. This would help to regulate the flow of persons so that crowds of persons do not arrive at the same time and have hours to wait. Madam Speaker, I now turn to the measures. But before I do that, Madam Speaker, my recollection of the appointment system is that when we started vaccinations, we had actually started insisting on appointments. That was my recollection. And then persons turned up without appointment. And the public cry at the time became, so if persons turn up, why you don't let them? And we ended up having appointments and persons walking in. And then the persons walking in far outnumbered the appointments, overwhelming the system. We had to respond and change. And so we only did walk-ins, knowing that that eventually would be the danger when more persons come in and overwhelm the system than you are resourced to manage. Of course, during the time it takes to scale up the system to meet the demand, persons will be inconvenienced. That inconvenience will generate its own public upset. And that public upset will not necessarily pay attention to all the other issues. So the government is trying to be responsive to its citizens, but at the same time creating another problem. So, Madam Speaker, we will have to return to the appointment system. We'll try to expand that very rapidly to make it more responsive and easier to use, but it is not going to be possible to have a wholly and solely walk-in system for vaccinations. It will, even with the best resource system, if more persons turn up than the system is scaled for, you will have increased waiting time given the articulated procedures that we have for your own safety and protection. So, Madam Speaker, I now turn to the measures. The Cabinet met on Monday, and I noticed on Monday, Madam Speaker, that there was a particular text circulated about a press conference. Just to be clear, we did not circulate such a text, and I know that many persons believe that. Madam Speaker, you know, along with the pandemic is the infodemic, the circulation of information that is not true. But there was a very instructive response which says that, you know, we should try to give notice of the measures long before the measures expire. And while it is a perception, it is not accurate that the government does not give notice. It is very rare that we don't give even 24 hours notice. In fact, I recall only once that we have had to go immediately without giving at least 24 hours notice. And we do try to give at least 2 days notice. And bearing in mind that sometimes the data only comes back, hours before we are actually able to come to the public. And ministers will tell you that we are at cabinet, we deliberate, and as we are finished, we go straight into the press conference. Minister Tufton has a regular COVID conversation, which is designed, if you listen to the press conferences and COVID conversations, you will see the sync of the information flow. So Minister will go and provide the details of the general clinical issues, and then I will come and give the details of the non-clinical issues. And basically, the COVID conversation would prepare the country for what the measures could look like. So we have a fairly well-structured and thought-out communication strategy. It won't always work, Madam Speaker, given the level of frustration that exists in the country and fatigue, and then we are competing with other voices. Some of them have deliberate intent to mislead and create mayhem. And we always have to be consistent and on message and keep the information flowing. So, Madam Speaker, we do give notice of measures when they are going to be changed. So, Madam Speaker, as I was saying, the Cabinet met on Monday and decided on the following new measures effective from Saturday, September 18 until October 28, 2021. Of course, you know that the curfews go to 5 a.m. the following day. So for curfews, the effective date would be October 29th, 2021 at 5 a.m. Now, curfews. Effective from Sunday, September 18th, the curfew hours will be as follows. Mondays to Fridays from 8 p.m. nightly to 5 a.m. the following morning. Let me repeat, on Mondays to Fridays from 8 p.m. nightly to 5 a.m. the following morning. On Saturdays, the curfew will commence at 6 p.m. and continue all day. It starts at 6 p.m. and continues for the rest of the day, Saturday, to 5 a.m. Now, bear in mind, Sunday is a no movement day. Right. So I want to read it carefully so everybody understands. So on Saturday, technically the curfew begins at 6 p.m. on Saturday. But it will continue throughout Sunday to 5 a.m. on Monday. All right? So Sunday is a no movement day. For clarity, the weekday no movement days will be discontinued. So the no movement day on Monday and the no movement day on Tuesday will be discontinued. But from Saturday 6 p.m. straight through Sunday to 5 a.m. on Monday, full curfew, no movement. The public should bear in mind that National Heroes Day, Monday, October 18th, which is a public holiday, will also be a no movement day. So Heroes Day, Monday, October 18th, will be a no movement day. Madam Speaker, we have changed the curfew hour from 7 p.m. to 8 p.m. on Mondays to Fridays, not as a loosening up of measures. I don't want that to be the interpretation. The epidemiologists and other experts at the Ministry of Health, having reviewed the data, and we're now starting to examine transportation in greater detail, took the view that 8 o'clock is a better time to allow for the clearing of congestion and to reduce the crushing of persons trying to get onto public transportation to get home. So it is a consideration of the public's convenience and safety, and not a consideration of increasing movement times. That's not the objective of it. So we have moved from 7 to 8 p.m. in recognition of this challenge that we face when we have tighter curfews, especially if we have to have them over a long period of time. Madam Speaker, as I was interviewed today, I had to make the point that the government does not rely on enforcement for these measures. No government can. We can attempt to enforce periodically, intermittently, but given all the other challenges that we have, we couldn't divert all our security force resources into enforcement. What we rely on is the compliance, the voluntary compliance of citizens. People who understand the challenges that we face and say, my duty as a citizen of this country who would want to see the best of my country, act in the best interest of the country by observing its laws. And Madam Speaker, there are many Jamaicans who do that every single day. And Madam Speaker, we must make it easier for the people of the country to follow the law. We must make laws that are difficult to follow. We must always design our laws to make it easier and convenient for persons to comply. And that is a lesson that this government has always learned. We have always followed that. And where we see challenges, we have always adjusted. So we have seen the challenges with the curfews. Madam Speaker, we want the vaccination program to continue in full force, even on no movement days. Certain vaccination sites will be open on no movement days, and persons who wish to receive the vaccine will be allowed to do so. Quick word on the ENDS program, that is the e-commerce national delivery system, continues to be operational, and we encourage persons to use the system. Businesses and delivery operators registered on the ENDS system will be able to operate after curfew hours until midnight and on no movement days. The general public gathering limit remains at 10 persons. Places of worship will continue to be restricted to having no more than 20 persons in attendance. The number of persons permitted to physically attend a wedding remains at 20. The limit on persons physically attending annual or extraordinary general meetings remains at 20. No physical attendance will be allowed at any event hosted by a public entity. Only virtual events will be permitted. The existing work from home directive in the public sector is being extended until October 28, 2021. Permanent secretaries and heads of agencies are directed to strictly ensure that only persons who work in critical service delivery and the nature of the work requires that the job functions are performed at the physical location of the office. Only those persons should be allowed to come to work. For private sector, I urge employers to ensure only employees who cannot work from home actually come into the workplace. In terms of places of worship, As I've said before, they will be restricted to having no more than 20 persons attending in person, including the clergy and support personnel. No crusades, conferences, or conventions are permitted. The same arrangements that were in place over the last 4 weeks in terms of allowing persons who worship on Sunday to be able to move about on no movement days, those arrangements remain in place. And this specifically is that the church would issue to the 20 congregants a specific form that is gazetted that would give them permission to travel on the no movement day. Madam Speaker, the government is sensitive to the emotional impact that the prohibition on funeral services has been having. We have therefore decided to allow funeral services, but with a maximum of 20 persons physically present, including mourners, clergy, and support personnel. For clarity, this takes effect on Saturday, September 18th. Madam Speaker, I urge everyone to strictly follow the protocols and the restriction on numbers. If we observe any lack of compliance, we will have no option but to reconsider this allowance of funerals. Let me be clear, Madam Speaker. The existing restrictions and protocols for burials will continue. Burials are permitted on Monday to Friday between 9 a.m. and 4 p.m. with a maximum of 15 persons present. As a reminder, burials are not permitted on public holidays, and note that National Heroes Day falls within the period of the new measure, meaning it is a no movement day. So, Madam Speaker, I want to just clarify something here. So, the allowance for funerals starts on Saturday, the 18th. But remember now, burials are only permitted on a weekday, and they are not permitted on a weekend or on a no movement day. So we are not expecting that there would be any funerals on Saturday. It's highly unusual that people would have funerals on one day and then burial on another day. So the way in which we have designed it is that so that we don't have a different start time for different measures. So the entire set of orders starts on the 18th. This measure becomes effective on the 18th, but we are not expecting that there will be funerals on the 18th, bearing in mind that there are no burials on a Saturday. There is a consideration, however, Madam Speaker, which was brought to attention by the afterlife industry. In the recent heavy rain, yes, the afterlife, and that's what they call themselves. The undertakers and I know that would grab your attention. That's the term here. So a very important point was brought to our attention that sometimes when the burials have been affected by heavy rains, they have had to be rescheduled, and you know, the disruption could be long. So if it rains within the week, they would have to hold the body for an entire week and go into the weekday before they could bury. Now, what they're asking is for special permission to be given for burials to be rescheduled to a day that is not a no movement day. If, for example, there was heavy rains or other natural disasters that was declared as such by ODPEM, that they would be able to apply to ODPEM to have the burials rescheduled, as I said, to another day, meaning that in the event of heavy rains or other natural disasters that disrupts the funeral schedule, they could apply it to ODPEM, and ODPEM in its discretion could allow burials on a Saturday, for example, in this case. Now, barring any significant changes in our numbers, the new measures will generally remain in place from Saturday, September 18th until Thursday, October 28th. Madam Speaker, we are now moving away from more frequent adjustments to measures, which we have been doing in responding to changes in infection rates and hospitalization, and transitioning to an approach that will involve a fixed set of measures that will be responsive to the level of vaccination take-up rather than to outbreaks. Let me rephrase that. Not rephrase it, because let me explain it. Madam Speaker, where we are now in the pandemic is that we have sacrificed quite a bit with our economy. And it is amazing when I look at the figures that we continue to grow. And the economy continues to do well. Why is this possible? Why is this happening? Where in other countries, their economy is not recovering as fast. And as much as people criticize the government about its management of the pandemic, I urge them to think that we have never said that we would not be able to meet our wage bill. Other countries have had to deal with that. And in all the challenges, we have never said that we will not be able to meet the requests of the Ministry of Health. With all the challenges, there are persons who have the luxury of saying, spend more because you have more. In other disasters that have affected the country, that call could never have been made. So when you decide to be critical, which is your right, also bear in mind that the way in which we have, no, I don't, no, my words are not meant to be thrown. They are, anyway, bear in mind that we have also managed the country to keep the economy afloat and to give the economy the best chance of recovery. So, Madam Speaker, you know, this has been a very challenging time, and it is by virtue of not locking down the country too tight and opening up very quickly that we have managed to keep the economy buoyant, whilst at the same time preserving lives. But what that does, Madam Speaker, is the raging debates on both sides. There's one side of the debate that says, you know, keep the country locked down, keep our health system from collapsing. You know, I don't want to get exposed to the virus, I don't want to die. And then there's another side of the economy, which I met today in my friend opposite constituency, who are saying, no more lockdown. I want to live. I want to go out and have party. I want to go out and hustle. No more lockdown. And I am there in the middle trying to balance each side. Not an easy task. Not an easy task. Because one side feel that the other side mustn't have a voice. But everyone goes into that polling station and makes a vote. So I have to listen to every voice. The balance then, Madam Speaker, would have to be that the government has to now transition to having a set of guardrails that the country can know that these are the parameters and they are stable and fixed, and this is how we are going to have to operate. The government is now at a stage where it cannot continue to apply these blanket measures, these very crude measures, because, you know, it's like using a hammer to solve the problem, you know, of trying to kill a fly. So we can't keep doing these lockdowns for much longer. So we are going to set the curfew hours, and those curfew hours, you can rest assured that they will be firm and well established, and we won't change them. There would have to be a significant event in terms of, you know, a massive outbreak. But going forward, we will do some consultations to determine what is acceptable for everyone, and those will be the guardrails in terms of curfews, and they will continue right throughout. For now, we have set 8. From the perspective of the epidemiologists, 8 seems to be the sweet spot, but we will have further discussions with other stakeholders and see what else they propose. But right now, 8 o'clock seems to be it. 5 a.m. seems to be a good time, and that would appear to us now that that would be what I call the guardrails in which the society would have to operate. We may make some changes to gatherings, but right now the gatherings remain at 10, and events are not permitted. Once we reach a point where we know we are safe and the vaccination levels are high, then we may consider changes to the events protocols. But right now, with 7% vaccination, the national effort, the national attention, the national focus must be on increasing vaccination. These measures cannot change until we see a sustained and high threshold of vaccination in the country. There are many calls now being made for vaccine mandates. And I've long said that, you know, we have a liberal democracy. The framers of our democracy would have gone ahead of the rest of the region in putting in place measures to protect the freedoms of this country. So we can't be compared to, you know, other countries in the Eastern Caribbean. We have other considerations, and it forces this government to focus more on education and public engagement, which is why I'm reaching out again to leader of the opposition. Our voices have influence on our supporters and followers, and we need to make our voices heard separately and in unison on the subject of getting people vaccinated. So we will continue our program of educating and encouraging persons to be vaccinated. Eventually, it will evolve into a system where we will have to have differential treatment for persons who are vaccinated versus persons who are not. And we have seen that emerge right across the world for public health reasons. You know, I was reading recently in Denmark where they have now abolished their protocols, which we are now still enforcing. Why? Because they have reached such a high level of vaccination. They're at that point where they could return their society to normal. But before, you had to show your vaccination card to go into a nightclub. In other European countries that have, you know, constitutions that equally protect the liberty and freedom of their citizens, you have to show your vaccination card to get into a restaurant. So there will be, eventually, as we progress through this pandemic and increase the level of vaccination, it can't be that I get vaccinated, I do my national duty and get vaccinated to protect myself, my family, my community, and my country, and someone who shirks their responsibility and duties, sometimes for no genuine reason other than pure ignorance and deliberate, malicious intent, gets to go by on a free ride. Every citizen has to bear some responsibility and has a duty to get our society out of this crisis. And whilst I respect the views of persons who are genuinely scared or hesitant, at some point in time, reason must take hold. And you accept your responsibility and duty as a citizen of this country. Madam Speaker, as I close, I would like to address the recent cruise ship arrival on Monday, September 13th, which was a no-movement day. The government understands and indeed respects the sentiments expressed by many Jamaicans about cruise passengers being allowed to visit attractions while residents were subject to a no-movement order. This was not an easy decision for the government to take. And I would just quickly say here that in the first set of no-movement days, we restricted movements to attractions. We did, for the very reason that it would have been unfair. And it is a genuine concern, especially in a society like Jamaica, where unequal endowments, unequal treatments, and inequality in general is a fault line for our society. And the government considered it very carefully, and we said, no. But Madam Speaker, we had to take a second look at it. Because in trying to maintain the social balance and the social equity, we also find out that we are exacerbating the problem. If there is an opportunity for the tourism industry, and let me break that down, because when I say tourism industry, people think of big hotel owners. When you saw the complaints on the TV and in the papers, it wasn't big tourism people complaining. It was a craft vendor. It was the busman who, for months, have not earned any income. How is this attitude of trying to cut off your nose to spite your face, how is that going to correct the unequal endowments in the society? You know the classic theory of welfare, if you can make one person better and don't make anyone else worse off, that is a good decision. If you can make one person better off and nobody else worse off, governments have to think wisely and smartly. And this ambivalence that we have to get over it. We have to start to think about our economic progress now. So I think that we made a decision in favor of Jamaicans. We made a decision in favor of the taximan, in favor of the craft vendor. But this is not to say that there weren't problems. As they say, water more than flour. We didn't have enough cruise ships, it's just one. And so yes, persons were complaining. And I've gotten all the reports on it, and I've given some instructions regarding ensuring that there is equity and fairness. Even if it is one cruise ship, make we figure out how to share it up so that everybody who has been out of ground how long without any opportunity. So, Madam Speaker, the task of balancing lives and livelihoods is not easy. It is not for the faint-hearted. It requires making tough decisions, decisions that may not be popular but are in the long-term interests of our country. Our tourism industry and indeed our entire economy continues to be impacted severely by the ongoing effects of the pandemic. Madam Speaker, I challenge anyone to tell me that it would have been in our long-term interest not to accept the cruise ship coming into Jamaica. Despite all the challenges, Jamaica has done well and continues to do well in balancing lives and livelihoods. The fact is that we have grown in the pandemic. The PIOJ had recently upgraded its forecast for economic growth for the second quarter to 12.9%. Let us understand why these difficult choices are necessary. Let us not fall prey to misinformation and those who seek to sow division and discord and discontent among us. Let us come together as one people, one nation, indivisible, unitary, to overcome the pandemic and build forward stronger and better. Thank you.
Madam Speaker. Madam Speaker? Yes. Yeah. Yes. Madam Speaker, the opposition is fully committed to the important, critical reality that to get past this COVID-19 pandemic, we must find ways to persuade our people, adult population, to protect themselves by getting vaccinated. We are fully on board with that. We have demonstrated it personally by ourselves getting vaccinated, and many of us, and no doubt more every day, will be trying to make arrangements within our constituencies to bring vaccination to the comfort of their communities, so that people who might not be able to afford or otherwise be in a position to leave the communities to go and get vaccinated will be able to do so within the environments in which they live. I had a community vaccination event last week, Thursday, and I was pleased to have been able to arrange that and got support from the Minister. Mackenzie, thank you. And we had over 500 persons vaccinated on that day. And I gather that others have been doing it, and my colleague, Shadow Minister from East Kingston and Port Royal, the member for that constituency, had his today. And I know the impact that a group of young people who you came upon there had on your thinking as to how to deal with this matter going forward. Of course, vaccination is only part of, a very important part, but only part of what we need to do. And we are at a point where, despite the efforts that have been made to ramp up vaccination, flawed as they are, we are only at 7% of the population now having vaccinated. And we're way behind our peers in the region and internationally, those countries that have had a successful vaccination program. And when we see other countries opening up and the population getting the relief and benefit, psychological, economic, emotional, of having life return to normalcy, it is because those societies have been able to achieve a significant percentage of vaccination in their population. We were told 65% was the desired threshold for herd immunity. That is no longer clear, because as we know, as variants emerge that are more infectious than the original version of this virus, the percentage that is required to be vaccinated if you're going to achieve herd immunity may be higher than 65%. But it's a target that we will still work with, and we know the Ministry of Education, the Minister has indicated that for face-to-face in secondary school, we need to get to 65% of the cohort. It's a little distressing to see that the school year has started and the Pfizer vaccine was provided, which we've now run out of. And based on the statistics given today, we only have 22,000 roughly out of 73,000 who are vaccinated. Only 22,000 have had their second dose out of a cohort of over 200,000 students between the ages of 12 and 18. So around 10% of our secondary school students are fully vaccinated. 90% or thereabouts are not yet fully vaccinated, and we've run out of the Pfizer until such time as we are able to get some more. And the fact that we have 73,880 children vaccinated and only 22,000+ have had the second dose indicates that an error was made in ensuring that there was sufficient vaccine for the children to receive their second dose, and that the policy was not rigorously implemented, and so vaccines that were intended for secondary school students, some of them were used for adults. And we've heard the Prime Minister indicate that they're going to be much more rigorously enforcing the protocol the next time around. Prime Minister, we need to try and get these things right the first time. And this is a recurring theme. You know, even with the cruise ship situation, Prime Minister, you know, had there been proper communication around why it is that a cruise ship is being allowed to disembark its passengers on a no movement day, I don't think the furor which arose amongst the people for the unfairness of them being in lockdown while tourists are able to have a nice time and go to attractions, that disparity would not have struck such an angry chord. And then, that is bad and not so bad. We don't, before I even get to the next point, we don't know, there have been no adequate, in my view, explanation as to why it is safe to allow cruise ship passengers to disembark and go into among our population. What are the measures in place that give the necessary assurances that that is not going to spread infection in the country? I'm not saying that there is not a good answer to that. I'm saying it has not been properly communicated. So people are very upset about it. And then, when they do come on the lockdown day, the craft vendors are up in arms because they're not getting any of the business. And the bigger attractions are getting the business, and it reinforces this disparity, that fault line of which you speak. And now you're saying, well, next time we'll try and do better. Prime Minister, people are under stress. People are upset. There's a lot of hunger and suffering out there, and people are angry. We need to get these things right the first time round. Because it's... Social cohesion is critical in a crisis like this. Social cohesion matters because we're in a worse national crisis that any of us have lived through. That is why it is very important that we don't undermine the image of a unified approach towards vaccination and social distancing. But it's also why it's very important that we don't create the perception or reality of there being two Jamaicas in the way in which these rules are rolled out and affect the people. So we shouldn't have had a situation like Mocha Fest in July. We shouldn't have a situation where all of a sudden we hear a cruise ship is coming on a no movement day and there's no proper communication around why that is and how the society is protected from that. And similarly, we shouldn't have a situation where public officials and a minister are partying on a no movement day. And was it not for the fact that a video was surreptitiously taken of that and it went viral, we wouldn't even know about that. So we need to change that practice, Madam Speaker, and try to send a strong message, not only through the words that we express, but the way in which we behave that suggests that we are respectful of the rules that we are being asked to comply with, and that they apply across the board, not just to the ordinary folk, but to everybody, including the privileged and the well-connected. This is vital for social cohesion, which is essential if we are to get through this crisis. Madam Speaker, a task force has been set up to handle the operationalization of the National Vaccination Program, chaired by Professor Gordon Shirley, a very able Jamaican, with other representatives on it. We would have liked to have seen that expanded a bit to have a person representing the community of persons with disabilities who have been tremendously impacted by this pandemic, in a way perhaps more seriously than those who don't belong to that particular community, and also a community development person, expert, because a lot of the hesitancy and a lot of the issues around logistics are in the communities, rural and urban. But I would also have liked to have seen the mandate of that task force expanded. We know that the procurement of vaccines has been an issue in the country, and we know, and I want to salute the chairman of the National Health Fund, who has done a yeoman's job in trying to get vaccines to come here. But he himself has said that that system is not right, and that the Prime Minister must involve himself in the procurement of vaccination, because the system needs to be broadened. And I think that if you're setting up a task force, a high-level task force, which is something I was calling for from the budget debate, their mandate should include oversight and governance of the procurement of vaccines, because we are not there yet, and we are seeing issues even today where we run out of the Pfizer with people who have been scheduled for their second doses and they're not going to get it on the scheduled date, children included. Now we're hearing, well, from a public health or from a technical standpoint, it doesn't really matter because 3 weeks was the day that they were being scheduled, but it can go on beyond that and so on. But it affects people's psychological approach to vaccination, where they get their date and they're mentally attuned to it, and then all of a sudden they're told there's no vaccine for them and they don't know when that second dose is going to be available. We need to get these things right, and I think that the task force's terms of reference and mandate should be expanded to also deal with things like oxygen procurement. Because we've had a terrible debacle in August with a shortage of oxygen to the public health system, the facilities where people with serious respiratory challenges, people on death's door were faced with a shortage of oxygen. And allegations of some deaths in that scenario. We have called for an independent investigation of that. The minister has indicated he doesn't think it's necessary. So has the CMO. But quite frankly, it's not really, shouldn't lie in their decision to make that because they are implicated in it. It needs to be objective and it needs to be transparent. And I reiterate that call now. We want an independent investigation of what took place that weekend and why it took place and what is to be done to prevent it happening again. And the remit of this task force should be expanded so that all of the critical inputs in the fight against this pandemic, governance and technical oversight of it, is vested in a competent group of persons with shared responsibility who can bring the necessary intellectual and experiential expertise to ensure that we stop making these errors that are costing the country dearly and costing lives. Madam Speaker, the Prime Minister has outlined the series of measures that are going to govern the country's liberty from this Saturday through to October 28th, over a month. And Prime Minister, it's quite clear that what was put in place for the last 4 weeks really didn't have the desired impact. You've tried to say, well, we're moving sideways now and the curve is flattening and so on. But the truth is, based on reports, today's report, 21 people died from COVID in today's report. The positivity rate is over 40%. Hospitalizations have gone up day on day. And the positivity level, the positive testing is significant. So, Madam Speaker, Madam Speaker, you're an expert at that. Madam Speaker, I am just hopeful because I agree that we needed to change tack. It's quite clear that what we were doing with this 3 days on, 3 days off system wasn't working. It was ruining many small businesses and it wasn't having the desired public health results. I just hope that the Prime Minister, in coming to his decision about the new rules, is following the best technical and public health advice. I hope so. We haven't really heard from him what those advisors in the public health arena are saying about how we should move forward. I know that some of I believe the JMA, has indicated that they don't think we should move away from lockdowns. I don't know, the CMO I think had indicated her view on that as well. MAJ, what that's JMA? MAJ, Medical Association of Jamaica. Yes, of course. So I just hope that the Prime Minister is fully taking into account the technical advice from a public health perspective. Speaking for myself, I am very dubious about a system of rules that has the effect of encouraging or causing unnecessary congestion and gathering. And I believe the curfew, setting the curfew early every night, has that effect. Because people have things they have to do. People have to go and buy food. They may have to go to the pharmacy. They are leaving work and the rule was that they had to get off the road by 7 o'clock. Prime Minister, I've heard you say that the new guardrails are set and that 8 o'clock is the new start date. Speaking for myself, I would say to you, whatever will minimize congestion and gathering, which is where spread occurs, is where we should be going. So I don't know if 8 o'clock is the right time. I was hoping you would have come with a later time for the curfews. We need to reinforce the personal responsibility point, which you have highlighted and I am highlighting as well, which is don't talk up in other people's face or have them talk up in your face. Stay a good distance apart from other people, and when you're in a group of persons, put on your mask and keep on your mask. Just be sensible in how you deal with each other and how you move around in your daily life so you don't get this horrible virus, which can, if you're not strong or you're suffering from comorbidities or whatever it may be, you can end up very, very sick or even dead. So sensible liberty, sensible personal responsibility, choices is what we call for. But the rules must facilitate people being able to behave in a rational way to protect themselves. And poorly designed rules create situations in which people are forced to bungle, to herd, to be congested, and to behave in a way which is not consistent with trying to minimize the spread of infection. So I hope, Prime Minister, that 8 o'clock, you say you got that from the epidemiologists or the public health experts. I hope that guardrail is going to be kept under conscious, constant review, because I don't like to see and hear reports of people bungling up at supermarkets because they have to come off the road, bungling up at the transportation centers or anywhere else because they're going to get done what they have to get done just in the normal living of life. They have to do it in a congested, a truncated period of time, a short period of time, and they are consequently taking serious risks with their own health and the health of others around them. It does not make sense, and the rules should not force that. So please, Prime Minister, that guardrail, look into it on a constant basis and see what is happening out there as people respond in their daily lives to that guardrail of 8 o'clock, and see if it really makes sense, forcing people to be off the road at that hour when they have to go to the supermarket, or they have to go to the market, or they have to get home. Prime Minister, we are all in this thing together. And we are playing our part in trying to be constructive. I have made numerous suggestions as to what I think should be done to try and manage the pandemic better. I've made one today, which is expand the remit of the task force. I've called for trying to find ways to broaden the distribution of vaccines, to bring in the private sector and the private healthcare system, especially for those of the vaccines that don't require very careful storage at low temperatures. Fortunately, we have some very robust vaccines like the one I took and the one you took, which were designed to be used in environments where special refrigeration is not possible and for long periods of time. Let us enable our population to get vaccinated in as many and easiest way possible. And you know, this is a war. It's not a war against each other or a war man to man. It's a war against a virus, an invisible virus. And sometimes the old protocols and the old rules and the bureaucratic thinking has to be overridden. When I hear, for example, some of the excuses why we can't get critical things done on a timely basis in this war, it boggles the mind that procurement rules are why the 100 tablets that we were all allocated and which we have gone through significant hurdles to help our constituents access this online application. Many of them couldn't manage the forms and all, and we had to get in there, assign people to help them, and this was done months ago. And we're told they can't get the tablets because of procurement. That the children on path who are supposed to get tablets can't get the tablets because of, or the devices because of procurement, and we don't know when that is going to be overcome. This is madness. We can't make the rules govern the system. You know, we can't make rules that were designed for normal times stop us doing what we have to do in extraordinary times. That is bad government. That is ineffective. That is mismanagement. So, however you, and this is not to say, Madam Speaker, this is not to say, Madam Speaker, that transparency and accountability should be foregone. Nobody would be in favor of that. But there are ways and means of doing things so that you can account for what you have done and you can show value for money, but where the rules do not have to be applied in a way that stops critical things happening that need to happen to protect the people. Prime Minister, the last point I wish to make, and I know my colleagues in our team here have other issues that they either want to make or reinforce. But the last point I wish to make is to say this. Prime Minister, since this pandemic hit us, your government chose, rather than following the constitutional route of declaring a state of emergency as a result of this particular type of disaster, which is a pandemic, which the Charter of Rights specifically provides for. You decided not to go that route. And that is a decision which has been criticized. But I'm not getting into that debate now. But you took the decision to use the Disaster Risk Management Act. And it creates a lot of flexibility in it, and you have increased that flexibility with the amendments that were made earlier this year. But a fundamental part of that regime is the Council, the Disaster Risk Management Council. And when we're talking about a unified effort and all hands on deck and a common thinking so that we can tackle this thing in a cohesive way as a society that's strong and unitary, as you put it, that council is the fulcrum of that. It is supposed to be, you chair it, the leader of the opposition sits on it, and it has a broad-based representation to ensure the relevant expertise from all different sectors are present there. That council, Prime Minister, has not met since I became leader of the opposition. I do not know. Well, certainly I have not been invited to any council meeting.
On a point of order,
absolutely true.
Madam Speaker, on a point of order and permission to speak from the seat, Madam Speaker. Madam Speaker, the leader of the opposition have made this comment more than once, and I want to dispense that. The National Disaster Risk Management Committee, which is chaired by the Most Honourable Prime Minister, which I'm the Deputy Chairman, have met every year religiously as is required by law. The leader of the opposition was invited in writing to attend the meeting that was hosted at Jamaica House, a virtual meeting, Madam Chair. Last year, the then opposition spokesperson on local government attended, and I invited her to attend several meetings of the committees. So it is not true, Madam Speaker, that the committee has not met. They have met and have been meeting. The sector committees have been meeting, Madam Chair. So this notion by the leader of the opposition is misleading and is wrong, Madam Speaker. Himself and the General Secretary of his party was invited. And if my memory serves me correctly, I believe that Member Robinson was online.
Madam Speaker,
yes.
There was a Zoom.
Just a moment.
Yeah.
Is the minister correct in saying that you were invited?
I attended an online meeting. I attended it. Which, I don't think that was what I'm talking about. There was no discussion of any policy issues whatsoever at that meeting. It was a perfunctory process in which commitments to support the process were given. But a proper meeting to discuss the real issues has not happened.
Just a moment. What is important? What is important as members of Parliament and what gets to the public is whether or not what you have said is correct, or if it is not correct, and if it is not correct, then the proper thing for us to do is to withdraw it. I see the member, maybe I'm wrong, sitting at the back, shaking her head in agreement that I don't know.
Which member?
So,
Prime Minister?
Sir, thank you for acknowledging me, Leader, and Leader of the Opposition, thank you for yielding. The committee is required by law to meet, my recollection of the law is once per year.
No.
Hold on.
No.
And then it has several subcommittees and sector committees. My understanding from the Minister is that the workload of managing the particular disaster is delegated downwards through the various committees, and those committees actually meet on a regular basis.
Madam Speaker, it is not the intention, I believe, of that law that the council on which the Prime Minister and the Leader of Opposition sit along with many of is purely a ceremonial thing. We had a ceremonial gathering on Zoom. It didn't address any of the real issues of managing the pandemic, and there's no rule in the law that says that council is to meet once a year. I have looked at it. It doesn't matter. My point is, if you want to have a unitary approach with all hands on deck, let the council function, at least meet quarterly. At least meet quarterly, so that we can be kept abreast of what these sectoral gatherings are about. And he said there's sectoral committees meeting. I don't know anything about what they are doing. I am on the council, and I have no idea what it is that is going on. There is no proper accountability for their performance. So I'm saying the law facilitates meeting. We can meet monthly if necessary. I'm not suggesting we need to meet monthly, but at least quarterly. We should be having those meetings. We should be hearing what has been going on and what the problems are and how we correct them. If you want all hands on deck, it's not just talk. It's not just talk. It is about actual organizing the way in which we approach these things, so everybody's input is available and and we are all on board. And that has not been happening. And I called for it in my budget presentation, and I still haven't seen that happen. And I'm reiterating that call again now. Let us use that council for its intended purpose, and let us meet regularly to hear what is going on, what is not happening that should be happening, what the plans are to correct it, and how we can get this thing on the right direction moving forward. What is going on now is not good enough, and I want to see an improvement. And it's within the powers of the Prime Minister and his colleagues to have that happen. I can't convene a meeting. I don't have that power. I don't share it. So that is what I would like to see happen. And you know, Minister Mackenzie, I hear you. Madam Speaker, I won't go there. He's my neighbor and I check for him as a brethren. Thank you very much, Madam Speaker. I thank you.
Members, please. Announcements. There's a hand. Oh.
Madam Speaker, just three quick observations. Firstly, Prime Minister, you alluded to it earlier about needles and the fear of needles. And today I had personal experiences. In fact, I can use myself in the past. But today, at the vaccination blitz, more people came and wanted the Johnson & Johnson. And I was amazed that in my discussions with my constituents today, the hesitancy was there, and it is not really anti-vaxxers. Jamaicans have a fear of needles, and it is real, and they don't believe you that you don't feel a thing. Well, I didn't feel anything when I got the jab. So I think your public education probably needs to stress that a little bit more. But I want to get to a more serious point, because you have been speaking a lot about lives and livelihood. And one of the points I want to make today is the announcement yesterday of a price increase for electricity. It is particularly sensitive now, Prime Minister, because we are urging our people to tanner them yard, to stay inside, no schools. People are at home, and unfortunately in our society, we use more electricity for domestic use than for commercial use. And so, especially now, so people have been seeing a spike in their electricity over the last 18 months. And I believe, even though the OUR has a legal authority and they are carrying out their responsibilities, even though some of the issues that came out yesterday, I think those issues require probing, but I believe that in good conscience, the JPSCO should not be, at this time, imposing this price increase. And Prime Minister, I'm urging the government to use your influence in urging the JPSCO to put a hold on any price increase in electricity at this time. Thirdly, Prime Minister, I of course endorse what the leader of the opposition said about the issue of oxygen. And it's an issue I had raised here when we had a discussion earlier in the year. So there, I'm hoping, will be some probing of that, but I just want to be assured going forward, because in this pandemic, the importance of adequate supply of oxygen has been stated time and time again. How are we for the future? Have we corrected the problems of the past? And we have had two episodes of problems in relation to oxygen. Can we be assured that if, God forbid, we have a fourth spike, are we going to be able to have adequate supplies of oxygen going forward? Thank you very much.
Madam Speaker, I just want to reiterate a point I've made a number of times. The Prime Minister has announced some new measures that will hold for the next 6 weeks. While it represents an easing of the restrictions, and that will allow more people to earn and work, we still need to be very cognizant of the pressures that the most vulnerable are facing. If you look at the increases in the prices of basic food items from the beginning of this year, they have been significant. All the trends point to a continuation in price increases, at least for the next 6 months, driven by factors which may be outside the control of the government, driven by supply chain issues, mainly out of China, driven by the increase in demand for commodities. All the factors point to basic food items continuing to go up. So yes, we expect and we have seen a recovery in the economy. But let's not forget, there are still thousands of people who are not back to where they were prior to COVID.
Oh, the economy is not
Well, the economy isn't. I mean, we have a 12% increase in the quarter, but we fell by 18% last year, right? Also, we need to understand, Madam Speaker, even with the little that we got as members of Parliament, the $3 million, which all of us will appreciate, can probably do 1,000 good packages, food packages, where you put in 2 pounds of flour, 2 pounds of sugar, 2 pounds of rice, cornmeal, some bully beef, big gilla oil, sardine, mackerel. That's what you can do, but you can do 1,000 people at maximum. 1,000 people at maximum. Some people represent constituencies with 40,000 electors. I have 22 electors, but I have about 50,000 people. All I'm saying to you, in this environment, there are people who are struggling under the pressure of these increases. The JPS increase will push everything else up. The dollar is appreciating, but we know in this country, even when it appreciates, no price don't come down.
It appreciate it till the end of September.
I know, because we know the dynamics there. But prices never ever come down. They only go up. And people are pricing at 155 and 160. I'm saying to you, there is real struggle, even for people who are, you may not consider to be in the category of the vulnerable. Earning people, monthly paid people, feeling it from the gas prices. We looked at the difference between last year and this year is 40% increase in gas. 40% at the pump. We're not talking about what the marketing companies add. I am just saying, in all of the considerations, and it don't necessarily have to come through the MPs with what you give me, because quite frankly, when you announce the 3 million, it set you up more than it helped you. Because everybody come knocking on your door expecting, right? So I'm not saying it don't necessarily must come through us, but other mechanisms have to be found during this period to address those people who are struggling. The economy cannot grow. The economy will grow. Let me take back my words. The economy will grow
From a low base.
From a low base. But the issue of equity, the issue of equity is what we have to deal with.
Survival.
And survival. And the money that people are earning just can't stretch based on what it was. And given the trends, these pressures are going to continue for at least another 6 months. So just putting that back on the table squarely. We have some, the Prime Minister said, it's a good problem to have when you say spend more. But the reality is, what we have in terms of the revenues we have gotten from the taxes, which are mainly from the imports, that has been the biggest jump, import taxes, right? We have spent less than we projected for the quarter, 7.5 billion less. Put the money into the economy to help those who are struggling. It will also help the economy to grow, because they are going to consume, they can't save. Those persons are not saving, they're not in a position to save. The issue of poverty will not go away simply by growth in the economy. It will only take very deliberate and concentrated effort. And I must tell you, I was very disappointed when I heard the Minister of Education, because her statement has given me no confidence about how we're dealing with the challenge of education and those children who are most vulnerable and don't have access. So if the issue is money, right? If the issue is money, we have reserves, we have revenues that we can put in place to ensure kids can get devices. Right? So I just putting this back on the table in the consideration. It's real hardship. Every one of us, we are MPs. We feel it. We get the cause. I'll tell you, sometimes the cause you get from people, I mean, there's a place in my constituency, very middle class area, right? Where the person, the cost of that property is millions of dollars. Them own the property, but they don't have the income. And when the lady called me first to ask me for a food package, I didn't believe it until I went there. Right? Real suffering. Even though if you look at the address, you would never believe it. That is the reality. And I'm just saying, Prime Minister, in all the considerations, ensure that we provide for those who are struggling and who are vulnerable. Thank you.
Prime Minister, I want to just quickly follow on my colleague, because if the middle, you can, well, you and I share borders, so you understand what I'm about to say, that if the middle class is under the kind of pressure that they're under, you and I know what we are going through. You in another way, I in another way, because beyond that, areas of Riverton, Seaview, Color Muse, these are New Haven. These are difficult area, difficult circumstance. I haven't gone through my vaccination, community vaccination yet, although I intend to. But what we saw already in some areas about the vaccination and the bungling that has occurred in some areas, we can be avoided and must be avoided. The Shirley Task Force comes, I believe, a bit late. If you recall, in May of last year, when the pandemic was in full flight, I wrote in the Gleaner, it was published, I wrote that we have to pay a special attention to the logistics and the whole supply chain situation. Why have I said so, and what is repeating itself? This is something for professionals, not simply people who have been doing it over and over and over, because it's going to require outside the box thinking to address some issues. So it really requires professionals to deal with some of these issues, because you have to think on the spot, and not simply because you've been doing it for 10 years or 20 years, you know what to do. These logistic issues are very serious. I want to point out to you, Prime Minister, that at the port, there are issues occurring at the port with things, congestions taking place at the port of Kingston, and they're beginning to affect how the movements of products in and out of the country. Someone called me this morning to say that they've had products that have come in, and for 3 weeks they've been on the wharf, cannot be cleared, and in the meantime they are aggregating a lot of penalties and fees and costs. When they eventually clear those products, they're going to pass on those costs to the consumer. So we have to be very careful and understand how this is going to impact. And I want to say that even as we're in this together, it's a war that we're in together. You said you've asked us and we're willing to work together, but it can't be when the problem comes. When there's a foresighting and we can't call for certain measures before it happens, they need to be considered seriously. And we need to feel that when we call for those measures, there is a consideration, a serious consideration of them, and not simply when the crisis has occurred and it started to pile up on us. Because in the sense, it don't help any of us. It doesn't help any of us, because we want to get out of this crisis, not stay in it. So, Prime Minister, I'm saying to you, this matter of the supply chain, the logistics, and this Christmas is coming, and if it starts already, when the Christmas peak time comes, it's a problem. So please get on top of it, pay attention to it, so that the cost of the supply chain and logistics does not begin it's already started. Because we know a lot of the increases, some of it has been due to the freight costs. It's going to get worse. So let us get ahead of it. Let us be proactive and let us deal with it so that we don't need to be trying to find mitigating or trying to address a problem that can be avoided in the first place. I ask, humbly ask.
Yes, Comrade, I'm verse, Madam Speaker. Madam Speaker, Mr. Prime Minister, I wanted, you spoke earlier about personal responsibility, and I believe in personal responsibility. But one of the things that irks me in the conversation about personal responsibility is the responsibility of the state. Because when we call on people to exercise personal responsibility, the state also has to make sure that they take care of their responsibility. And with that, I'm talking still about the crowding at our government offices, yes, and those public buildings, whether it is police record, whether it is tax office and stuff like that. I believe that since we know that those are super spreaders as well, we need to make sure that something is put in place to assist with that and to make sure that when persons go there, they don't find the kind of lines and the kind of crowding that is there. One of your members might ask me for suggestions, but since I know I'm a member of the opposition, I know that it is not always my duty to find the solutions. I identify where there are gaps, and those with the data and with more information than I have should craft the responses. So I want to raise that. The other is around the inconsistencies in enforcement. You are correct that the society has been a very unequal one in a long time. And that whenever you look and you see, for example, that the police, if somebody will say a little thing about you, a man scrape them up and them gone. I don't know what I'm gone for, but that's how it appears. But yet some other people you hear about yacht and party, it's a big picture of some other things, and the same thing does not happen to those people. It creates a problem, because one of the things we want to see between our government and its people is trust. And these kind of inconsistencies really eat away at trust and becomes a problem. The last thing I wanted to say, Mr. Prime Minister, has to do with this notion. Well, I'm glad, first of all, that you started saying that, at least that's what how I interpreted it, that you weren't going for mandatory vaccines. But this notion of 65% vaccination in our schools before having schools face-to-face, for me is an issue. Why is it an issue? First of all, it has to do with availability and accessibility in terms of vaccines. That's just one issue, yes? If there are persons who want to get it and can't get it, for example, you can't bring that kind of mandate. You can't have a system, no, but you haven't said to us, for example, that based on the supply, we would have enough to reach that 65% if everybody take it up by X. So we're operating in just this kind of blind way of not even knowing what that target is. So that's one. The second thing is that persons who are vaccinated can have breakthrough infections and can pass it on. So what are we doing? What are we saying? Students who don't have access to vaccine because there are no vaccines available must come out of them yard. Them can't stay there until a vaccine is made. If we can find ways, and other people across the world are there doing it. It's not easy. It is not just waving a wand, but if we understand that face-to-face engagement for teaching and learning is important, then as a state, we have a responsibility to see how we do that. Once we recognize, and I'm hoping that we're going to be reading what other people are doing, so we can actually see it and be convinced ourselves that it's possible. Once we get there and recognize that it is possible, then we come to the notion of how we actually do face-to-face for secondary. For secondary. I still believe that school is a place of learning. I don't know how many people don't, but I do. And because it is a place of learning, I also know that some of those students will probably be better convinced of the importance of taking it at school rather than at home. I'm convinced of that. And so, I mean, I have seen mothers trying to get the children to come and the children hiding, bawling. I had to rescue one of them because she was in tears. She has heard so many things about this vaccine and what this vaccine does that she don't even want to leave her yard, and she's not coming for no vaccine. Now, if we have to look at how we approach it, that allows individuals to break through this barrier of misinformation and disinformation. And it is possible. And I don't want us to close our schools and prevent that. And worst of all, Mr. Prime Minister, I do not want the most vulnerable and at-risk students to be the ones that we deny entry, because they may be the ones most likely not to be vaccinated. And again, what that is going to do is that unequal situation that we have been having. And it's going to exacerbate it. And so I'm calling and asking for you to look at that and to pay special attention to that.
Thank you, members, for your questions. Thank you, Madam Speaker. Mindful of the time, approaching curfew hours, though we are exempt, we still want to maintain the curfew hours. But, Madam Speaker, the questions raised by the members, some of them are in the form of statements which really don't require my response. They have made statements and positions. There are some that do require some responses. The question asked by the member from Southwest, my neighbor, regarding the government's policy for vaccination in order to enable face-to-face learning. The policy is that once a school attains 65% of its population, school population, vaccinated, then that school would become a candidate for returning to face-to-face. Of course, the minister will explain that there may be other things that the school would have to satisfy, but certainly that is the target threshold. Your point that people who are vaccinated can have breakthrough infections and can pass it on is real. But once you start to reopen, you are now into the realm of risk management. So what is the greater risk? Certainly the greater risk would be for persons who are unvaccinated versus persons who are vaccinated. So you would be taking less of a risk in having face-to-face learning with students who are vaccinated. And so that would be the logic. Would it be fair to prevent students who are not vaccinated from coming into school? Well, now that becomes a matter for parents. Parents would be saying to the Ministry of Education, to this school, you know, I don't want to take the risk of my child who is vaccinated still being infected, because vaccinated people can still get breakthrough infections. You see the reverse part of the argument that you have just made. Yeah, so your part of the argument is for the unvaccinated person. So why are you depriving me of entering the school? Because you can still get infected. And the person who is vaccinating is saying, exactly for that reason you shouldn't come into the school, because you're at a higher risk of infecting me. We're going to have this kind of debate in the society as we progress through the pandemic. But certainly what will happen is that the more people get vaccinated, it is the more you're going to have people agreeing with the position that they should be treated differentially, meaning that they should be allowed to go into pharmacies and parties and do whatever they want because they are vaccinated. They have taken on the social responsibility and their duty, and therefore they should be rewarded. So you have raised the issue of the equity question, and that is something that we will look into. Well, we have been looking into it, because what we have agreed to do is to have the schools become centers of vaccination for their ecosystem. So not every school will become a vaccination site, but once we get the sustained supply of the Pfizer vaccine and that is sorted out, then we will start to use the school nurses in coordination with the Ministry of Health to have schools, which the ministry is well structured to do this, because you have the feeder school system. So you can have one central school vaccinating all the feeder schools. And that is the strategy which we will be deploying. Very important that it be done via the ecosystem, because we need to know school by school how many students are vaccinated. And it is easier to mobilize if it is the principal that is mobilizing the students to come into the schools. So that is the strategy, and that is how we intend to reduce any inequity of access for the vaccine, which is a very important point. We wouldn't want there to be a vaccine inequity in access. So that is something that we'll be paying close attention to. The leader of the opposition had raised the issue about the protocols for cruise ships coming in. I'm advised that 95% of the cruise ship passengers are vaccinated. The other 5% would be children who accompany them who cannot be vaccinated. There is a very robust set of protocols that follow the cruise ship passengers around. So I would give the assurance to the country that a very strong set of protocols were in place, and that 95% of the 1,700 persons who came were vaccinated. You're not going to find 1,700 persons gathered in Jamaica presently at any one time and having a 97 or 95, except here, which is just 63 of us, right? So the cruise ship passengers coming here do not pose a greater risk than any citizen here moving around. So that's a point that I would want to make. The issue made by the member from St. Andrew Southeast, valid points raised regarding government ensuring that during this pandemic we don't forget the poor. Madam Speaker, the admonition given to me, which was given to the former leader of the Jamaica Labour Party by the founder of the Jamaica Labour Party, the Right Excellent Sir Alexander Bustamante, said to the Most Honourable Edward Seaga, don't forget the poor. And Mr. Seaga, in his last days, when I had the chance to be around him, said, Andrew, don't forget the poor. And Madam Speaker, this Jamaica Labour Party government has never forgotten the poor. And we have an approach to addressing poverty. And I like what was said a while ago, that I think you're the one who said it, member from South, that poverty is not going to reduce because there is growth. You have to take instrumental action. You have to have programs that are deliberate in their nature in attacking poverty. And that is why this government could report twice that poverty has reduced. This government has reported one of the largest reductions in poverty because we have been very targeted and strategic. Madam Speaker, in the reduction of poverty, you have several elements. Dimensions of poverty. You have the income dimension, which is what the member was speaking about, that we need to supplement the income of the poor, either by conditional or direct, unconditional cash transfers, or by assisting them with skills so that they can work and earn. Then there is the dimension of knowledge and information. Again, the member raised the issue, being disappointed about the speed of procurement to assist students who are not able to navigate online because they don't have a device. So a new kind of inequality in the education system is emerging, those who can afford devices versus those who don't. And that's another dimension of poverty, the education of the poor. And then the third dimension is the alienation. That is, you have the access to amenities, but the alienation is big. People feeling that, well, the rich get better treatment and better access to justice, or don't have to be subject to the law because they are rich, whilst the poor get subject to the law in the worst way. And this government, Madam Speaker, is sensitive to all three of those dimensions of poverty. When it comes to treating with the income of the poor, the admonition of the member from Southeast St. Andrew is that we must spend the reserves and get money into the pockets of the poor through the social safety net. I mean, it's the obvious thing to say, it is the right thing to say, but the government is doing that and has already done that and will continue to do that. In this pandemic, this government was able to respond and give 500,000 Jamaicans, 500,000 Jamaicans, the biggest social transfer ever done in this country, to support the poor. We have never forgotten the poor in this pandemic. Never. And Madam Speaker, it wasn't done in the traditional way, because another point raised by the leader of the opposition, and he made a profound statement, and I will quote him on it. He says that in these extraordinary times, the government must use extraordinary measures. That is a profound statement. But you know what? That is what you call a bait. The moment this government take the bait, is the same leader of the opposition that will turn around and say, this is a government that is involved in all kind of things. Right? That is what will happen. This government can't take that bait. The same mouth telling us to go and do the thing and ignore process is the same one who will come. Hold on. It's the same set of people who will come and say, why you never follow process? That when them get into the PAAC and they start their machinations to accuse and create all kinds of false and negative narrative. Right? So, Madam Speaker, we're not taking that bait. The argument that is a legitimate and solid argument is that government bureaucracy must become more efficient. But that is a separate argument. And that is what we have always been saying. That the flip side, of corruption is inefficiency. If you want to deal with corruption, deal with efficiency. And what we have in Jamaica is an overly bureaucratic system with very little effort on getting it efficient. And I struggle with that, Madam Speaker, every single day. How to get our bureaucratic system moving more effectively and timely. It is a constant struggle. And Madam Speaker, to be fair, when I was in the opposition, members on that side, I don't see the specific members in the House today, but members on that side used to say to me in the lunchroom downstairs how difficult they found the public bureaucracy, how difficult they found the procurement system, and how they would want to get things done more quickly, but they used to complain about it all the time. And we see that now, Madam Speaker, that there is a challenge. It is.
Well, thank you for yielding. Madam Speaker, on a point of order, just to clarify, no one is saying that the law should be broken. But essentially what I'm saying, in extraordinary times, part of the role of the government in managing it is to not to let the existing rules that were designed for normal times to get in the way of doing what needs to be done. And there are ways of doing that in a transparent and accountable way that doesn't allow anything improper to take place, but it must be done efficiently and in the best interest of the people. That's all I was saying.
Madam Speaker, this government managed to distribute care benefits to 500,000 Jamaicans with the highest level of probity and accountability. Nobody can raise any questions. It will go through the Auditor General, it will pass through the PAAC, it will obviously go through the highest level of scrutiny. And Madam Speaker, we in no way avoided the process. What we did was to put in place an efficient process that utilized technology to digitize much of what was done. The benefits were all done through 90% through an online system. And Madam Speaker, what this pandemic has shown is that our disorganized society, our siloed and bureaucratic and segmented society is difficult to organize and very difficult to deliver service to because, Madam Speaker, we do not have a system of properly identifying and targeting beneficiaries. And I say this, Madam Speaker, because if you took just the vaccination process, that just to deliver the vaccine, and a time-consuming element of that process is registration. Registration. If we had a national registration system for every single Jamaican with one unique identifier. Stop, don't even stop. with one unique identifier, Madam Speaker, you would eliminate 20 to 30 minutes of the process of getting vaccinated. If you had a proper registry of your citizens with a unique system of identification, treating with poverty would be a targeted affair instead of a blanket affair, because you would be able now to transfer directly. But better than that, it would support the cashless society. You would be able to build the digital society with direct wireless, what you call direct deposits to accounts. The benefit of having a national identification system, shortly called the NIDS. Those, Madam Speaker, would be the benefit. But we went through this back and forth in this Parliament, and you know, it's coming now. We think we have a bill that meets the requirement. But all we are trying to do is make it more efficient for us to serve the poor. Because right now, the poor have to go and struggle to get their path check member from Southeast. They have to struggle to go get the little path check, and they have to go stand up in line to change it. And it's a real struggle. And it's a part of that bundling that you see there is, again, the whole business of not having a society that has gone digital. Because half of the transactions, if not more than half of the transactions that are conducted, could all be done virtually. But without a system of verifying identity, people are required to present themselves physically to conduct transactions. And this is what the NIDS will do. The NIDS will enable the society to transition to far more digital transactions. So the question about what do we need to do to prevent the bundling at the tax office, at the banks, well, let's get the NIDS passed very quickly. But outside of that, but outside of that, Madam Speaker, there are some things that the government is considering, which I did mention in my presentation, but just quickly to say, one, we have to look at opening some of these services on the weekend, especially the tax office, so that there are more service days than currently exist. So that is something that we are actively studying, how that could be done, what would the cost and the impact and so forth. So very shortly, we should come to that. And then it is the staggered work hours. So we have reached out to the private sector to say this is a conversation now that we are seriously going to have to determine how we can get industries to stagger.
Minister, don't the flexi work
Yes.
law makes provision for that, for the private sector too? As I recall, the provision I've been served on the committee is you have 40 hours work week, and an employer in agreement with the employee can run that 40-hour over any period of the 7 days. So it's a matter of utilizing something which is already there.
So remember, you're quite correct. So there are laws to allow for the flexi work week. The question is, how do you get industries to move in unison on it? Now already, some industries have started to adjust. We look at the BPOs, and they obviously utilize, they have several shifts, they're working from home. So they have adjusted in terms of how they manage with the pandemic. We noticed that some retail outlets, supermarkets and wholesales, their opening times would have normally been from 9. Some of them are opening as early as 7. So there are some adjustments taking place, but we need to get it streamlined on an industry-wide scale so that, for example, banks could then say, all right, how can we get some of our banking services open on a weekend? It has to be that all of them move together, otherwise it becomes, a kind of competitive situation. I would have added that without you saying it, but anticipated that you would say it. So, Madam Speaker, there are some innovative things that the government is contemplating. They will obviously take a little time to be implemented because we have to get the stakeholders on board. But we acknowledge that the measures have impacted on our movement, our economy, and so forth. And for us to compensate for that, we need to find other ways of allowing persons to get the services that they are being denied by virtue of these restrictions. Madam Speaker, the issues of the increase in energy prices, JPS prices, I will have the Minister of Energy address that issue. He would have a better brief on that. I have a brief, obviously, but I'm not prepared to talk about it here at this time. I'll ask the Minister to, and I'm sure that there will be some discussions on that. So, Madam Speaker, in terms of the logistics issues and the prices, we are managing that. We are monitoring that very, very closely. And if you have specific things that you would like to point out, please feel free to send me some notes on those specific bottlenecks that you are seeing at the port. Madam Speaker, having regard to the...
It's now 7 o'clock, member. We have people at staff that have to...
Investigation from the deaths occurring from alleged deaths occurring from oxygen shortage.
So, Madam Speaker, as it relates to oxygen, I'd prefer the Minister of Health to give you the specifics, but I could tell you what I'm involved in. One of the things that I'm working on is to get in a supply of oxygen concentrators that would be distributed right across the country. Enough supplies, bearing in mind that oxygen concentrators would not be perfect substitutes for high flow cylinder generated oxygen. So, but they do help for, persons who are afflicted by COVID but not seriously. So we will have supplies of those oxygen concentrators. We are also now looking at acquiring the larger ones, the larger oxygen concentrators that would supply the needs for entire hospitals. And in fact, we are pursuing a source through a UN agency, and the Minister of Health could tell you more about that. So we will have some backup capacities within hospitals. The supply in terms of from the local supplier, my understanding is that they are still negotiating, that they are considering making more investments in their own local capacity. And I'm certain that the Minister can give you more details about how that conversation is going. But I'm fairly satisfied that they have tied down supplies, that they can bring in supplies quickly. I want us to bear in mind, however, that no matter what plans we have in terms of bringing in supplies and securing from suppliers, if everyone else in the world is having a spike, or if people in your region are having a spike, you are always at risk of a force majeure event, meaning that something can happen in the supply chain. The supplier who you made the order with can always say to you, I am sorry, my friend, though we have a contract, I am going to use the force majeure clause in the contract because I have to supply the oxygen to my population first. And that is always a risk, no matter how much forward contracts you have, no matter how much supplies you have bought in advance. Once it has to be imported in, that is a challenge. So the solution one is you need to have some of the production capacity local to the hospital, so you should be able to have from your oxygen concentrators and the large ones. And we need to have the investment here locally to expand the plant so that, well, you know, this is not a closed market, and that is the issue. It is not a closed market. So other producers and suppliers. Well, I wouldn't be able to speak that. But what I'm saying, our market is not closed, and other investors should see the opportunity and come in. But I will ask the Minister of Health, member from St. Catherine South, to give a full report on the oxygen situation and where they are to correct that. Now, my understanding of any death in Jamaica is that it has to be investigated. And my understanding is that the coroner, or whether it is the police or whoever investigates, is that they are independent. And I'm certain that the Ministry of Health is investigating all deaths that have occurred because of COVID. All of them. And you know why I have confidence, total confidence in the report of the Ministry of Health? Because, you know, this government has never hidden the cause of death of any citizen during the pandemic. I mean, the suggestion that somehow the Ministry of Health is not going to give us an accurate report, I kind of reject that. I mean, one of the hallmark of the management is that we have given the public the full details. With whatever is the consequence, we say what it is. So, look, we have an interest to know if patients died because of lack of oxygen. If it is that the opposition or others are saying that the government was negligent or doctors and nurses were negligent, I think, Madam Speaker, that in the pandemic, what we have seen is that everyone worked tirelessly and diligently to save lives, given the circumstances. So, Madam Speaker, I have confidence in what the Ministry of Health will report on the deaths. And I will study it very carefully before I make any other comments on it.
Thank you very much. Announcements.
Laid on the table of the House today are the following. Ministry Paper number 56 of 2021, entitled The Department of Correctional Services Annual Report for the period January 1 to December 31, 2015. Ministry Paper number 57 of 2021, entitled Annual Report of the Parole Board for the period April 1, 2018 to March 31, 2019. Ministry Paper number 58 of 2021, entitled Annual Report on Audited Financial Statements of the Coconut Industry Board for the year ending December 31, 2019. Ministry Paper number 59 of 2021, entitled The Biosafety Policy for Jamaica. Ministry Paper number 60 of 2021, entitled Update to the 2015 Climate Change Framework. Ministry Paper number 61 of 2021, entitled The Emissions Policy Framework for Jamaica. Ministry Paper number 62 of 2021, entitled Jamaica Deposit Insurance Annual Report for the year ending March 31, 2020. Ministry Paper number 63 of 2021, entitled The Annual Report on Audited Financial Statements of the General Legal Counsel for the year 2020-21. Annual Report for the Jamaica Promotion Corporation for the financial year ending March 31, 2021. Annual Report of the Jamaica Intellectual Property Office for the years 2009 to 2010 and 2010 to 2011. Annual Report on Audited Financial Statements of the Kingston Free Zone Company Limited for the financial year 2018-2019. Annual Report of the National Water Commission for the financial years 2016-2017 and 2017-2018. Annual Report of the National Water Commission for the financial year 2018-2019. Annual Report of the Early Childhood Commission for the financial year 2019-2020. Annual Report of the Office of the Political Ombudsman for the financial year ended March 2019. Annual Report of the Jamaica Fire Brigade for the year ended 2016-2017. Annual Report of the Milk River Bath for the year 2019-2020. Jamaica Hansard Parliamentary Proceedings for the Honorable House of Representatives for session 2015 to 2016, volume 41, number 3, dated from January 12, 2016 to March 2019, 2016. Jamaica Parliamentary Proceeding for the Honorable House of Representatives, session 2016-2017, volume 42, number 1, dated April 14, 2016 to July 26, 2016. Jamaica Parliamentary Report of the Honorable House of Representatives, session 2016 to 2017, volume 42, number 2, for September 13, 2016 to December 6, 2016. And the Constabulary Force Act, amendment of Second Schedule Order 2021 under the Constabulary Force Act.
Bills brought from the Senate, petitions, papers, reports from committees, notices of motions given orally.
Madam Speaker, I beg to give notice that at the next meeting of the House, I will move the following motion. Be it resolved that the Constabulary Force amendment of Second Schedule Order 2021 under the Constabulary Force Act, which was laid on the table of the House on the 15th day of September 2021, be referred to the Regulations Committee of the House of Representatives for consideration and report. Madam Speaker, I further beg to give notice that at the later stage today, I will move for the suspension of the standing orders to enable me to take this motion.
House Leader.
Madam Speaker, I'd like to give notice that at the next meeting of the House, the House Leader will move, be it resolved that this Honourable House of Representatives call upon the Government to take into account proposals put forward by Members of Parliament regarding constituency matters in reviewing the budget for the current financial year and forecasting the estimate of revenue and expenditure for the 2022-2023 financial year.
Questions and answers to questions. Motions that may be made at the commencement of public business requiring notice. Motions relating to sittings of the House. Motions for leave to introduce bills. Presentation of bills without leave of the House first obtained. Public business.
Madam Speaker, I now move for the suspension of the standing orders to enable me to take the motion, notes of which I gave earlier.
The question is that the standing orders be suspended to enable the Minister to take the motion, notice of which he gave earlier. Those in favour? Those against? Those in favour?
Aye.
The ayes have it.
Madam Speaker, a simple motion which is seeking to legitimize the extent or the of the executive of Jamaica Police Federation.
Minister, there being no debate, I would imagine you would like to, or are there persons who? So, Minister, you can put them on. You ask that the motion be approved. Very well. The question is that the motion of which the Minister gave earlier notice be approved. Those in favour?
Aye.
Those against? The ayes have it. The motion has been approved. House Leader? No, that's it.
Madam Speaker, there being no further business, I beg to move that this Honourable House be adjourned until September 22nd at 2 p.m.
Go ahead.
Thank you. Madam Speaker, before we complete proceedings, I just crave your leave just to mention this issue. I want to bring to the House's attention the passing of Mr. Howard Hamilton, QC, Queen's Counsel, the first public defender and a leader at the criminal bar. He is somebody who was a highly esteemed advocate and somebody who the legal profession held in the highest esteem. He also, in addition to having such a successful practice as an advocate, was a person who was willing to give of himself in public service, and holding the position of public defender the first time, I think it is worthy of note. And he unfortunately passed recently, and I just want to bring this to the House's attention. You know, in doing so, I would just mention that the public defender legislation doesn't presently allow as ruled by the court interpreting that legislation, allow the public defender to, as I understand it, to initiate or intervene in pending legal proceedings. And I think that is a lacuna which ought to be fixed legislatively so that the public defender can play the role that I think was intended for that officer to play, that they can take steps to protect people's rights and intervene in proceedings where people's rights are impacted, even if they aren't themselves a party to those proceedings. And I think it would be a suitable amendment to honour the memory of Howard Hamilton QC, if that were done. And so I just want to express my condolences to his family, many of them, the members of which are persons I've known a long time, and to thank him for his great service to the country. Thank you, Madam Speaker.
Just before you stand, it's just about 7, almost 7:20. Needs to be a motion for the extension of the sitting of the House after 7:20. I noticed the Attorney General. Well, the Attorney General rose to speak, and it's now 7:20. So the question before the House is that the sittings of the House be extended beyond 7:20. Those in favor? Those against, the ayes have it. Okay, Attorney General, go ahead.
Thank you, Madam Speaker. I join in extending condolence to Mr. Hamilton's family. Indeed, he was an outstanding member of the Jamaican Bar and of the rank of Queen's Counsel and our first public defender. One of his children is my constituent in St. James West Central, Mrs. Candice Craig. So I put on record condolence as Attorney General and head of the bar to his family and remember his outstanding contribution to the legal profession. He was also a good friend of my husband and someone I knew personally. I share the view of the leader of the opposition that the legislation needs to be amended, but for a different reason, in light of the new charter arrangements and moving the rights from a strictly vertical arrangement to a vertical and horizontal arrangement is enough to revisit the legislation. But, Madam Speaker, Mr. Howard Hamilton, Queen's Counsel, was indeed an outstanding advocate and made a fine contribution not only to the Jamaican bar, but also to the country. May his soul rest in peace.
Thank you, Attorney General. I just want to inquire of the House. House Leader said we would adjourn until the 22nd of September. Now, the 22nd is Wednesday, and Tuesday is the 21st. Is it the 21st or the 22nd?
Madam Speaker, it's the 21st. I was going to adjust that.
The question before the House is that the House to adjourn until Tuesday, the 21st of September. Those in favor? Those against? The ayes have it. This Honourable House is now adjourned.
The following is brought to you by the Office of the Prime Minister.
When your turn comes for the vaccine, please take the vaccine. It is absolutely important for those.
Extend a very special welcome to everyone else tuned in on everyone else tuned in on Zoom, Facebook, everyone else Instagram, Facebook, as well as DBJ MSME recovery. Without any further ado, we will get into the program. So our first speaker will be DBJ's Managing Director, Mr. Milverton Reynolds. Mr. Reynolds joined DBJ as Managing Director in 2007 after distinguished service in the private and public sectors, ultimately heading entities such as Life of Jamaica, National Housing Trust, among others. Over the past 15 years, he has transformed the DBJ into what you see today, an institution delivering a range of successful initiatives supporting economic growth, entrepreneurship, job creation, and development, all while maintaining the bank's stability. While these initiatives have included support for large investments, strategic investments, or BPO sector, public and private partnerships and privatization, venture capital and private equity. Mr. Reynolds has a soft spot for MSMEs, and he has driven a raft of programs over the years to promote growth and access to finance for thousands of businesses all along the business cycle. Loans, guarantees, capacity building, grants, and equity. Ladies and gentlemen, please join me in welcoming Mr. Milverton Reynolds to deliver the opening remarks.
Thank you, Edison, for that very generous introduction. Dr. the Honorable Nigel Clarke, the Minister of Finance and the Public Service, who we were hoping would have been here with us in person, but unfortunately is not able to do so and will be joining us digitally. Mr. Edison Galbraith, our General Manager for Channels, Relationships, and Marketing at the DBJ, members of the media, all those who are joining us on Zoom. Good afternoon, ladies and gentlemen. I want to thank you for joining us both physically here at the Jamaica Pegasus and online for this very important event that the Development Bank of Jamaica is hosting today. Before I get started, I'd like to officially add my words of welcome to Dr. the Honorable Nigel Clarke, the Minister of Finance and the Public Service, who has graciously agreed to clear his diary and to participate in this launch. As I said, he will be doing so digitally. Welcome, Minister, and we thank you for your participation as our guest speaker. I'd also like to welcome our directors, who I know will be joining us via Zoom. There's no question that COVID-19 has created havoc and untold disruption in every area of life, including the marketplace and, of course,